Hannah.
Hi.
Nice to meet you.
Nice to see you.
How are you?
I'm okay.
All right. I'm Dr. Matt. I'm going to do your women's health examination today. So yeah, I see here that you're the first time in our clinic. And can you please tell me when was your last OBGYN annual?
A year ago.
A year ago. Okay. All right. So since you're a first-time patient, I'm going to have to go through a series of questions to make sure that I know you very well. And let's go and check today's date. Can you please verify your first and last name and your date of birth?
Anna Johnson, March 10, 1992.
Okay. Okay. Who's your primary care provider?
Madeline Drummond.
Okay. Do you have any drug allergies?
No.
Any sensitivities?
No.
Okay. All right, so you're here for your annual exam. Do you have any issues?
I do have a little bit of dryness and pain sometimes, but it's not that severe.
Okay. And have you noticed that the dryness and pain are in a certain time of your period or in the month?
Yeah, usually it's in the middle of my period. It's like in the middle of the month.
Okay. Okay. When was your last menstrual period? The date?
Oh, June 28th.
Okay. And would you say that your periods are regular, irregular, or no periods?
Regular.
Regular. Okay. Any changes?
No.
Okay. Are you taking hormone therapy?
No.
Are you sexually active?
Yes.
Okay. Do you use any method of contraception?
Yes.
Okay. Which one?
I do the birth control.
Okay. Okay. And for how long have you been on the birth control?
Like for 3 months.
Okay. Do you drink alcohol?
No.
Okay. When was your last pap test?
A year ago.
So we're not going to do one this year. Okay. Do you remember the results from a year ago?
They were good.
They were good? Okay. All right. Have you ever had a colonoscopy?
No.
All right. A mammogram?
No.
Okay. All right. Have you ever had a bone density screening test?
No.
Okay. Do you exercise?
Yes.
All right. How many minutes and per week would you say?
I would say like 3 times per week, an hour a day.
Okay. So 180. Okay. All right. Any hospitalizations or surgeries?
No.
Okay. Any illnesses in your family?
No.
All right. Have you experienced any significant weight loss?
No.
All right. Any constipation?
Yes.
All right. For how long have you had that?
I had that for the past like 6 months.
Okay. Any urgency when you go to the bathroom?
No.
Okay. All right. Any breast pain?
No.
All right. Any moles?
No.
Okay. No abnormal bleeding either?
No.
Okay. How would you describe your periods? Are they painful, not painful?
I would say more painful.
Okay. Are you experiencing any pelvic or abdominal pain?
And both during my periods.
During, okay. And when, during that time, would you say, how would you rate your pain from a 0 to 10, 10 being
I would
excruciating
say
pain?
4, 5.
Okay. Any anxiety or depression?
Maybe a little bit of anxiety.
Okay. And would you say that it's interfering with your daily activities?
It does sometimes.
Okay. Are you taking any measures to control that? Is it working?
Yes, I would say. I mean, like working out helps me a lot, and I'm taking like natural precautions as a CBD oil.
Okay. Yeah, CBT is very good. If you need anything from me, go ahead and let me know, okay? I'll be
Okay.
more than happy to help you out with that. Have you noticed any hair loss?
No,
Okay. Any hot flashes?
no.
All right. So it looks like we're going to go ahead and begin the exam. Okay. So I'll take your temperature. All right. Just gonna go on your index finger. Okay. And since it's the first time at our clinic, I would like to take a baseline of your blood pressure. We do that with our patients. And then we do it once a year as well. Okay. Okay, blood pressure looks very good. 125/60. Okay. Oxygenation 98% at room air. Heart rate is 80. Excellent. All right, I'm going to go ahead and listen to your heart and your lungs. Can you take a deep breath in and exhale? Okay. And again, take a deep breath in and breathe out. All right. Go ahead and breathe normal. I'm just going to listen to your heart. Okay. Regular heart rhythm. All right, I'm going to have you change in this gown and we're going to do the exam. Okay, and I'm just going to go ahead and put gloves on. Do you do self-breast examinations?
Yes,
Okay. How often?
maybe once a month.
Once a month is perfect. Okay. Alright, so I'm gonna go ahead and first examine your lymph nodes and mammary glands in the armpit. Okay, so we're going to start with the right one. I'm just going to palpate. I'm looking for any swelling. Okay, and on the left side. Not feeling any swelling. No lymph node enlargement. Okay. So I'm going to go ahead and open the gown, take a look at the breast. So first we're going to compare, look for symmetry. Okay, it seems like your left is a little bit larger than the right, which is normal. I'm not seeing any redness. All right, so I'm going to go ahead and use a circular motion to palpate. Let me know if you feel any kind of pain. So we're looking for any cysts.
I don't feel anything.
Okay. That's definitely a good sign that you do not have any pain. Do you drink a lot of coffee?
Yes, I do.
Okay. Sometimes caffeine can contribute to the pain during the menstrual period. So reducing that in chocolate could diminish the tenderness. Okay. Not feeling anything. Looks very normal. Okay. At 12 o'clock, I'm feeling a small cyst. Seems to be fluid. Sometimes those could be caused by hormonal imbalances, and they go away with the menstrual cycle. Okay, so I'm gonna have you lay down and I'll do an abdominal exam, so pelvic and also a vaginal examination, okay?
Okay.
All right, Anna, are you comfortable?
Yes.
Okay, so I'm gonna go ahead and open the gown. So we're gonna take a look at the pelvis and the pelvic area. Okay. I'm going to do a gentle palpation, okay? Let me know if you feel any kind of pain. So we're looking for any enlargement of the ovaries or uterus, since you did say that you're having some issues. Okay. Here is the left ovary. Okay, I'm going to palpate uterus. A little bit hard and tensed. Could be enlarged. We would definitely know for sure with an ultrasound. Okay. Checking left ovary. No, sorry, right ovary. Okay. One small scratch here. No, not scratch. Looks like a cut.
Yeah.
Okay. Did you have any procedures done or just
Yes.
an accident?
Just an accident.
Okay. Okay. Okay, here is the right ovary. Any pain when I'm pressing down?
A little bit.
Okay.
Yeah, and here too. Not as much. No. No.
Okay, so increased tenderness on the left side. The left ovary does seem to be a little bit enlarged. Okay, so let's go ahead and do a vaginal exam as well. Okay, Anna, so I'm going to go ahead and explain everything that I'm doing before I'm doing it so that you're prepared and you know what's going to happen. I'm going to lift the gown a little bit up so I can take a look. Okay. And just going to get the tones. Perfect. So taking a look, I'm not seeing any lumps. Right. Bartholin cyst are non-swollen visually. I'm not seeing any secretions. I'm gonna go ahead and palpate on the outside area. Let me know if you feel any kind of pain. So you're gonna feel my fingers here, okay? Okay. I'm not feeling any cysts. Okay. Alright, so since you did complain of some dryness, I'm gonna go ahead and take a sample, alright? And we're going to send it to the lab. Okay. So that's one. We said we're not going to do PAP, but we are going to do just a few tests to see if we find anything that we can treat. Okay. Alright, so now I'm going to go ahead and use a speculum. It's going to feel a little bit cold. That usually helps to enlarge the canal and be able to visualize the cervix. We're going to take a look and see if there's any bleeding, okay? Alright, so you're going to feel a little bit of coldness here. Okay. And there's a little bit of redness. I'm just going to go ahead and take a sample of that. Okay. So you're going to feel one more pinch, all right? Okay, perfect. So let's go ahead and take that. And I'm going to send this to the lab. Okay. All right. Well, we finalized the test. I'm gonna have you sit up and we're going to discuss the results, okay? Okay, and I'm just going to take my gloves off. Everything looks good. So we did take a few samples and we're going to send those to the lab. I'm going to have your results, I would say, in about 48 hours to 72, so 2 to 3 days. If you don't hear from me, that's a good sign, okay? If anything comes back suspicious, then I will definitely give you a call as soon as possible.
Okay,
All right? I'm going to go ahead and prescribe some vitamins. And I'll have you take those once a day, all right, in the morning. Also, I'm gonna have you go do some other tests, okay? So we'll do a blood work and we'll test your estrogen, your prolactin, and other hormones to see if there is any imbalance there. All right, we're gonna do an ultrasound of the ovaries, since on the left side I did notice a little bit of enlargement. Some people are born anatomically like that, so that could be normal. But if there is something else, we will definitely have the results with the ultrasound. So we'll do that. I'll have you schedule it whenever you have a chance, and the order is going to be in the computer, so they'll be able to see it. Okay. And after that, we're just gonna go day by day and see the results from the tests. All right.
Sounds good.
Do you have any questions for me?
No, not really.
All right. It was very nice to meet you.
Nice to meet you.
Thank you for coming.
Thank you.
Hi, Niso.
Hi, how are you?
I'm good. I'm Dr. Matt. I'm going to go ahead and take a look at your back. But before we begin, go ahead and tell me if you're having any pain.
Yeah, so I actually work out quite a lot, and recently I've just been feeling a lot of back pain. I was doing some back workouts a few days ago, and I started feeling a lot of pain in like the mid to lower section. I am a little sore, but I sit down a lot during my work days, and it's just been hurting quite a bit, so I thought I'd get it checked out.
Okay. Have you ever had a chiropractic adjustment before?
I did once a long, long time ago, but not in the recent years, no.
Okay. And any accidents that I should know of?
No, not really. I do just move my body around a lot every day, so it's...
So no bike accidents, no swimming accidents, car?
No, thank God.
Not even... Good. Not even when you were little or anything like that?
No.
Okay.
No.
Okay, just making sure. And have you noticed any shoulder pain? Any neck pain?
Definitely neck pain. I feel a lot over here. I definitely feel super tense and just sore all the time.
Is it radiating towards one side more than the other?
I would say they're pretty equal.
Okay. Are you having any headaches?
Once or twice a week I'll get little migraines, and my neck pain is there along with like the soreness, but that's about it.
Yeah, sometimes we can get that with the neck pain, migraines, so hopefully we can go ahead and see how we can help you today.
Awesome, thank you.
Are you having any leg problems?
My knees have been hurting lately anytime I start to warm up or run, or sometimes even just like getting up from a chair.
Okay.
They get really, really sore. But that's about it.
Okay, so what I'm gonna have you do, I'll have you stand up and take a few steps. We'll take a look at your gait and your shoulders and also hip alignment.
Okay, sounds good.
Okay, so from where you are, go ahead a little bit farther. Okay, I'm gonna have you walk towards me and then turn around, go back, and then come again towards me. Okay?
Okay.
All right, so go ahead, you can begin. Okay. Well, actually, it's not bad. Go ahead, keep going. It looks pretty even. A few more steps. Okay, I'm gonna have you turn around and we'll take a look at your back now. Okay. All right. Taking a look at your neck. So we're looking for any signs of inflammation. Can you go ahead and try to level your chin with the ground, so parallel? Perfect. Okay. Looking at the shoulders, definitely an elevation on the left side, so slight asymmetry there. Okay, let's go ahead and take a look at your hips. I'm going to lower your pants a little bit down. Okay. So, lumbar area. I'm going to have you press down with your right heel in front of you. Perfect. Okay. Come back to center and do the same thing on the left side. Okay. Come back to center. Alright, I'm gonna have you lift your right knee up, just like that. Alright, any pain here?
No.
Okay, come back to center. And same thing on the other side. Okay, come back to center. Alright, hips look pretty good, but I am noticing that you have flat feet, so that might be one problem why the muscles in the back are a little bit out of balance. Hips, though, they're not too bad. We can definitely readjust that in just one sitting. All right, so I'm going to have you sit on the table now. Okay, so I'm just going to go ahead and palpate your cervical spine, starting with C1. Okay, so you said that the pain is mainly in the lower back, correct?
Correct.
Okay. Okay. Definitely you're having less mobility in the lower back, and that might be the problem why you're having so much pain here. So we're gonna go ahead and work on just, stretching those ligaments around your vertebrae here so that we create a space and allow for better mobility. Okay, I'm going to do some tests here. Go ahead and tell me if this feels cold or warm.
Warm. Cold. Warm. Warm. Cold. 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 Warm. Warm. Cold. Cold.
Okay, and can you tell me if this feels warm all the way down?
Yes.
And now?
Yes.
Okay. Does this feel cold or warm?
Cold. Cold.
And I'm going to touch you with two textures now. One is going to feel dull. This is what dull is going to feel like. And the other one is going to be sharp. This is what sharp is going to be. Go ahead and tell me if you feel sharp or dull.
Sharp. Sharp. Dull. Dull. Sharp. 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 Dull. 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 Sharp. Sharp. Dull. Sharp.
Okay. I'm going to take some measurements here. I'm going to look for any asymmetry and signs of inflammation. About a 10-degree change, I would say. Okay, I'm going to use the reflex hammer to see if I'm eliciting any kind of nerve response. Okay. Okay, slight asymmetry on the upper side of the body as well. So what I'm gonna do now is I will have you lay down and we're gonna start with the neck. See if we can do some adjustments there.
Okay.
Okay, so go ahead and relax your head and your neck. I'm going to start by palpating the occipital lobes of your head. Okay, does seem very tight. And I honestly don't want to go in and start adjusting you right away. We should go ahead and loosen up those muscles and those knots so that it's easier for us to adjust your neck. Okay, I'm going to apply some oil. It's gonna feel kind of hot in the beginning.
Okay. It smells really nice.
Yes, it does have a very soothing scent. So I'm going to use my knuckles here, and I'm going to increase pressure as we go in. Let me know if it's too much, okay?
Okay.
So we're stretching the fibers of the skull as well, focusing on the lower lobes. Okay, it feels a lot better now. All right. So on a count of 3, I'm going to ask you to take a deep breath in, and we'll do the first adjustment. Go ahead and take a deep breath in. 1, 2, 3. And breathe out. Good. And again, take a deep breath in. 1, 2, 3. And breathe out. Good. Okay. Let's go ahead and take a look at your feet. Okay, so taking a look here at your knees. Slight elevation of the left leg. Okay. All right, go ahead and relax your leg, okay? Okay, good. Relax. Okay, pretty good mobility there. Alright, so what I'm gonna do is I will press down on your leg. I'm gonna need you to try to lift it up, okay?
Okay.
Okay, good. One more time. Okay. I'm gonna try to open your legs. Don't let me do that, okay? Good. And I'm gonna try to close them. Don't let me do that. Okay. And now go ahead and try to pull the front part of your feet towards you. Okay, good. And now push with the bats. Good. Okay. Now push with the heel. Okay. Okay, I'm going to apply the same type of oil on the sole of your feet. And I'm going to work on the muscles before we do the adjustment. All right, go ahead and relax. Okay. Any pain as I'm doing this?
No.
Okay. Okay, relax. Okay, those ones didn't want to crack. All right, let's go ahead and try to elongate your legs a little bit. So go ahead and take a deep breath in and breathe out. Good. And again, take a deep breath in, breathe out. Good. Perfect. Okay, Nisa, so we're gonna go ahead and adjust your hips now, all right? So I'm gonna have you lift this knee up just like that and give yourself a hug. Perfect. And on the count of 3, I'm gonna have you take a deep breath in and breathe out. 1, 2, 3. Okay, perfect. And we'll do the same thing on the other side. Go ahead and switch. And we'll take a deep breath in. 1, 2, 3. And breathe out. Perfect. Okay, I'm gonna have you flip over on your belly and we'll take a look at your spine. Okay. Okay, focusing on the lumbar and sacral area. We're just looking for any pulsations, any movements. Okay. I'm gonna have you lift your left leg up for me. Okay. Put it back down. And now the right leg. Okay. Put it back down. And we'll repeat that one more time. Left leg. Okay. Back down. And the other one. Okay. Back down. Alright, so I think I know what we need to do. Let's go ahead and we're going to tackle these muscles right here and I'm going to work on them. Just going to put the pants a little bit lower, if that's okay. Okay. We're going to work on lymphatic drainage on the legs as well. Okay, going to apply some oil. Guess it's gonna feel a little bit cold. You might see some redness here and there, but it just means that we were able to target the muscles and lots of toxins were released. Usually those toxins cause a lot of strain and inflexibility. I'm going to use cupping to release some of those toxins higher to the surface It also helps with circulation. Okay, so let's go ahead and do some adjustments here. Okay, I'm gonna have you put your arms around your body. Perfect. A little bit lower. Yes. Okay, and on the count of 3, I'm gonna have you take a deep breath in and then breathe out, okay? 1, 2, 3. Breathe out. Good. And again, take a deep breath in and breathe out. Okay, so what I'm gonna have you do is I'll have you lift your legs like this, keep them like that, and I'll have you hold your breath for 3 seconds, okay? So take a deep breath in, 1, 2, 3, hold it, and breathe out. Good. Okay. Okay, Nisa, so for this, I'm gonna have you put your hands behind your head, just like that, perfect, and try to keep your elbows together, all right? And I'm going to wrap my arms around your neck as well, and together we're gonna take a deep breath in and then exhale, okay? All right, take a deep breath in and breathe out. Perfect. Okay.
I cracked there again.
Awesome.
That felt great.
So that was really good. I really felt like we were able to adjust both shoulders, and today we took care of the hips and of the legs. We stretched them really good. I'm gonna need you to drink lots of water and try to stretch a lot before and after you work out.
Sounds good.
All right, how are you feeling right now?
I feel really light. I feel good. My soreness is a little gone now, so I feel really good.
Perfect. I'm gonna have you keep posture straight, okay? And try to not put your pelvis inside when you are sitting down on the desk.
Okay.
All right.
Sounds good. Thank you so much.
You're welcome.
Appreciate
I'll
it.
see you soon.
See you later.
Hi, Niso.
Hi.
I'm gonna go ahead and take a look at your scalp.
Okay.
Is there anything in particular that you're worried about?
Not really. I just want to get a little checkup and see everything is okay.
Okay. I'm going to start by examining your head, looking for any lumps, any deformities, making sure that everything is symmetric. We have lots of glands in the back of the neck as well, and in the back of the ears, right below the mastoid bone. We're looking for any swollen lumps. I'm not noticing any raised papules, which is a good sign of healthy scalps. Okay. Going to start by dividing the hair and taking a look at the skin. I can see that you have very thick hair. It does look healthy, but the scalp seems to be kind of dry. And in this session, I'm also going to test your sensitivities. And if needed, we're going to go ahead and start with a treatment.
Okay.
Can you please tell me how many times you feel this tapping?
1, 2. 2. 1. 1. 2. 3. 1.
Okay. I'm just going to touch you with a metal object. I'm looking to see if there is any edema. Skin seems to be a little bit swollen. Sometimes that can be a sign of dehydration. I'm going to touch you with two sides of this object, and I'm going to need you to tell me if you feel two pointy sides or just one.
Okay. 1. 1. 1. 1. 1. 1. 1. 1.
Okay. I'm going to touch you with two objects. One is going to feel sharp. This is what sharp is going to feel like.
Okay.
And the other one is going to be dull. This is what dull is going to be like.
Okay.
Go ahead and tell me if you feel this sharp or dull.
Dull. Dull. Sharp. Sharp. Dull. 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 Sharp. I think that was dull. Dull.
Okay. And can you please tell me if this feels cold or warm?
Warm. Cold. Cold. Warm. Warm. Warm.
I'm going to take a few measurements here. We're looking to see for the degree of inflammation. Go ahead and tell me if you feel this cold or warm.
Cold. Cold. Warm. Warm.
And does it feel sharp?
Yes.
And now?
Yes.
Does this feel sharp all the way?
Yes.
Okay. I'm going to touch you with two objects. One is going to feel metal. This is what metal is going to feel like.
Okay.
And the other one is going to be plastic. This is what plastic is going to be like. Go ahead and tell me if you feel metal or plastic.
Metal. Metal. Plastic. 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 Metal. 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 Plastic. Plastic. Plastic.
Okay. And now go ahead and tell me if you feel this sharp or dull.
Sharp. Dull. 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 Dull.
Okay. I am going to take a sample from the skin and we're going to go ahead and test it. So I'm going to apply a spray. This is going to help to be able to remove the cells. be collecting a sample now. I'm going to take a look at the hairline in the back of your scalp. Okay. We're looking for inflammation, any redness, okay, I would say slight edema, also showing some dehydration. Okay, go ahead and tell me when you don't feel the vibration anymore.
Don't feel it. No. No. No.
Okay, now tell me, does this feel equally on both sides, left and right?
What do you mean?
So the vibration, if it goes equally on both sides of your head.
Okay, good. Yes, it's on both sides.
Okay, perfect. Okay, go ahead and tell me, does this feel sharp all the way?
Yes.
What about now?
Yes.
And does this feel dull?
Yes. Yes. That was more sharp. I can't tell with that one. Dull. I think that was sharp.
Okay, does this feel cold or warm?
Cold. That's colder. Cold. Warm. Warm. Warm.
Okay, good. Does this feel 2 or 1?
1. I'm not sure. A 2. I think it was 2. 2. 1.
going to apply acupressure therapy. So it's going to leave kind of an indentation in the skin. This helps to trigger the nervous system to lower inflammation. I'm going to apply an anti-inflammatory treatment right at the base of the skull. This is a very relaxing oil. It has eucalyptus infused tincture. And this serum helps to regenerate hair follicles. Okay, go ahead and massage this in. I'm going to use a singing bowl to create a very relaxing environment, and we're going to make some vibrations that will really relax your scalp. And we're going to pair that with just a gentle hair brushing. Hi Katie.
Hi.
My name is Dr. Matt. How are you feeling today?
I'm feeling pretty good overall.
Okay. I see here that you made your annual appointment.
Mm-hmm.
Okay. Can you please verify your last name and your date of birth?
Sure. It's ASMR and March 24th, 1989.
89, you said?
89, yeah.
Okay. Do you have any allergies?
No, not that I'm aware of.
Okay. And are you taking any medications on a daily basis?
No, not right now.
Okay. Have you had any surgeries since the last time I saw you?
No.
Okay. And any injuries?
No injuries. I do have a tightness in my neck, and it radiates down here.
Okay.
And I don't know if that's going to go away on its own, but it started yesterday. I was giving my puppy a bath, and I was just in this weird ankle trying to just like get certain corners of her while she was moving around. And I don't know why, but after that, just kind of like really intense strain whenever I move my neck.
Okay, so moving neck.
Yeah.
And how bad was the pain, or was it
It's
on a scale of 0 to 10?
like a 7. Yeah.
Okay.
It's very noticeable when I move.
Okay. And was it sharp? Was it radiating on one side more than the other?
It's like it gets really sharp, and it's just on my left side. It gets really sharp whenever I like turn my head and rotate it.
Okay. Are you experiencing any pain in your hands or feet?
No, I can feel it too. My shoulder, my upper shoulder, and then it stops.
Okay. Are you having any abdominal pain?
No.
Discomfort?
No.
Okay. Any lower back problems?
No, I don't think so.
And if you try to touch your chin with your chest like this, are you having any pain down the spine?
So, right when my chin hits here, it starts to hurt. Like right here. Yeah.
Okay. And is it traveling down the back?
It's just in that area on the left side.
So
That,
still
yeah.
localized. Okay. There you go. I'm going to take your temperature. This will go on your forehead. And this will go on your index finger. We're going to do a very thorough checkup, make sure that we have all the vital signs. Good. And I'll take your blood pressure. Go ahead and use this one. I'm going to have you uncross your legs. You do have a tendency to have low blood pressure, so let's see how it looks today. Okay, blood pressure is 108/65. It's not too low, so that's a good sign. And oxygenation is 98, heart rate 72. All vital signs look very good. I do not have any concerns. Okay, I'm gonna have you change in this gown and we're gonna go ahead and begin the examination. Sure. So go ahead and have this closing in the back.
In the back? Okay. Great. I'll be right back.
I'm gonna go ahead and take some measurements. So we're going to check head circumference, making sure that everything is symmetric. And I'm gonna go ahead and check your arms as well. Perfect. And I'm gonna have you put your arms like this for me. Okay, very good. I'm gonna have you close your eyes, and can you please tell me if this feels equally on both sides of your head? Do you feel that equal?
It's hard to feel it at all, actually.
Okay.
Yes.
Okay. Go ahead and tell me when you don't feel the vibration anymore.
No. 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 No.
Okay. Go ahead and tell me which position here is louder. This is position number 1 or 2.
2.
And this is position number 1 or 2.
2.
Okay, doesn't seem to be any problems there. What I'm going to do now is I will gently tap on your face. Let me know if you feel any kind of pain. We're trying to see if we can elicit any type of neurological responses. Okay, so that was 1. Every time we keep on tapping on the face, we're waiting to see if there are any movements, and it should be less and less as we keep on tapping. All right, go ahead and relax. Good. Perfect. Okay. Okay. Diminish response on the left side. Good. Good. Okay. I'm going to touch your face with 2 objects in the same time. I'm going to need you to tell me if you feel them equally on both sides, okay?
Okay. Yes. 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 Yes.
Okay. And now I'll touch you with 2 objects. One is going to feel sharp. Go ahead and extend your palm for me. I'm going to show you what sharp is going to feel like. And the other one is going to be dull. Okay?
Cool.
So go ahead and tell me if you feel this sharp or dull.
Sharp. Dull. Dull. Sharp. 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 Dull. Dull. dull, sharp, 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 dull, 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 dull.
Okay. I'm going to go ahead and palpate your head. So we're looking for any lumps or asymmetry. Okay, I'm gonna have you turn your head this way. We're feeling lymph nodes as well. I'm going to check your arms as well for any swelling. Okay, go ahead and open your eyes. I'm going to have you look straight at my nose. I'm going to flash a light in your eyes. We're looking for pupil dilation and constriction. Okay, I'm going to have you Follow the light with your eyes only. Don't move your head. Okay. Very good. Now go ahead and look right here for me. A little bit higher. Okay. Going to palpate your sinuses. Looking for any swelling. Check hydration. Gently pressing down, see if there's any redness. Slight edema. Okay. I'm going to listen to your heart and lungs. I'm going to take this, put it over here. Is it okay if we open 2 of these buttons?
Yes.
Okay. I can hear a slight murmur. Also S1 and S2, but I'm a little bit concerned about that extra sound, so let's go ahead and check with the diaphragm as well. Yeah, we're gonna need to do further testing for that murmur. Go ahead and take a deep breath in and exhale. And again, take a deep breath in and exhale. Okay, go ahead and take a deep breath in and hold it for 1, 2, 3. Breathe out. Let's do that one more time. Take a deep breath in and hold it for 1, 2, 3. Breathe out. Okay, I'm going to check for jugular vein distension as well. And we're gonna have to listen to see if there is any external sound, any brewy, which is an indication of some circulation problems, go ahead and take a deep breath in and hold it for 1, 2, 3, breathe out. And we have to check on both sides. Take a deep breath in for 1, 2, 3. Good. Okay. So I would like to check your back now. I'm going to have you turn around facing the window there. Just going to close this. Okay, I'm just going to put your hair up and we're going to take a look at your spine. Okay. Open the gown in the back. And I'll start by palpating mastoid bones, which are right behind your ears. Feeling for any swelling, any edema, signs of inflammation. Moving down to the first occipital bone. And here we're going to make some movements as I'm palpating your neck. I want to see how the muscles are working together and if there is anything popping out as you're moving your neck, okay? Go ahead and touch your chin with your chest. Very good. On the left side? Yeah. Alright, so we're going to make a scale. It's going to be from 0 to 3. 0 is no pain, 3 is a lot of pain, 2 a little bit less, and 1 not so much pain. So right now on a scale of 0 to 3, how would you rate this? Okay. Go ahead and come back to normal. And now try to touch your left shoulder with your left ear. What number is it?
That's a 0.
0, okay. Let's do the same thing on the other side. What number is that?
3.
3. Is it on both sides or just one?
It's just on the left side, and it's like right down here. So it's not as far as it's like right down like inside of my shoulder.
Okay. Okay. Come back to center. All right, I'm going to have you lift your left arm up 90 degrees with your body. Go. Perfect. Okay, so now it's smoothing this side up. And I'm feeling a lot of tightness in this area. A little spine mobility as you moved your arm up. Okay, bring it back down. And We'll do the same thing on the other side. How's the pain now?
It's not that bad because you're touching the other side. It was really painful here, but not here.
Okay. Okay, go ahead and bring it back down. And what I'm gonna have you do now is to try to make an S with your spine. So you bring your shoulders forward. Perfect. Okay. So we're taking a look at the spine, see if there are any abnormal curvatures. And right at T1, your spine is shifting to the right side. So that makes a lot of sense why you're feeling all of that pain. And it's right in this area. So your spine goes straight, 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 normal curvature, and then boom, shifting to the right side, right over here at the junction between the cervical and thoracic. Come back to normal. Okay. And it's not so evident as you're sitting like this. It's more evident when you lean forward in that position. All right. We're going to tap on your spine, see if there is any kind of pain as I'm doing that. And let me know if you feel any kind of shooting sensation down the spine, especially here as we're approaching that space. Yes. Tell me when it stops, okay?
That's when it stops.
Right here.
Yeah.
Okay. Go ahead and tell me if you feel this sharp or dull.
Sharp. Dull. 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 Sharp. 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 Dull. 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 Sharp. 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 Dull. Sharp. Dull. Sharp. I couldn't tell. Dull. 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 Sharp. Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp. Dull. 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 Sharp. Sharp. Dull. 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 Sharp. Sharp. Dull. Dull. I couldn't tell. Sharp. 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 Dull. Sharp. 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 Dull. Dull. Sharp. Dull. 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 Sharp. 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 Dull. Dull. Dull.
Okay, very good. Right. Okay, I'm gonna have you lay down and I would like to take a look at your scalp
Okay.
and see if there is any sensory problems there too.
Okay.
Go ahead and take a look at your hairline first. I'm not seeing any redness. Some alopecia on the right upper side, and there's no sign of hair loss on the left side. Can you go ahead and tell me if this feels cold or warm?
Cold. 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 Warm.
Okay, does this feel cold on all three parts? That's 1, 2, and 3.
Definitely 1 and 3.
And this doesn't feel cold.
A little bit, yeah, it does.
Okay, go ahead and tell me if this feels sharp or dull.
Sharp. Sharp. Dull. Sharp.
Does this feel sharp all the way?
Yes.
Does this feel sharp all the way?
Yes.
What about now?
Yes.
Okay. Does this feel sharp or dull?
Dull. Dull. Dull.
Does this feel cold or warm?
Cold. Cold. Cold.
Go ahead and tell me if this feels sharp or dull.
Dull. Sharp. Sharp.
away from me. Does this feel sharp or dull?
Sharp. 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 Dull. Sharp. Dull. 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 Sharp. Dull. Dull. Sharp. Sharp. Sharp.
Okay. Does this feel cold or warm?
Cold. 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 Cold.
Okay. Go ahead and tell me if you feel this cold or warm.
Cold. Cold. Warm. Warm. Cold.
And does this feel sharp or dull?
Dull. Sharp. Sharp. Warm. Sharp.
Okay, is this cold or warm?
Cold. Warm.
Is this sharp or dull?
Dull. Sharp. Sharp. Sharp.
Okay. And does this feel sharp all the way?
Yes.
Okay, very good. All right. I'm gonna have you sit up. Okay, good. There were some problems with your scalp, and also I heard a murmur on the heart. Sounds a little bit concerning, but let's go ahead and just make more checks, more tests, and see if we come up with a diagnosis.
Okay.
The good thing is that you're feeling good right now, so you don't feel any problems with your heart. And also the neck and shoulder pain is a little bit concerning, so we're gonna send you for some x-ray just to double check and see if there is any deviation or need for surgery or anything like that. All right, and I'll let you know, and we're going to have a consult with a neurosurgeon. And for the scalp area, I just recommend some exercises for now to make sure that we stimulate and we bring a lot of blood flow to that area, okay? So the problem that I noticed more was on the right side.
Okay.
Right upper side. Okay. Seems like I'm throwing a lot of things at you right now. I'm so sorry. Do you have any questions for me?
It seems like a lot. Is there a chance that the heart issue is minor or that, it sounds like it could be serious? Right.
Heart problems, yes, they can be something that we definitely need to address. I can't tell right now how serious it is.
Okay.
Sometimes people are born with a murmur and they've had it all their lives and they don't know about it. And sometimes you can come to check up, hear the murmur, and go to the next one and not even hear any murmurs.
Okay.
So that's why I'm saying it could be something, but at the same time, let's just not jump to any conclusions.
Okay.
Do some more checkups and see if it's indeed something to be worried of, okay? I'm not worried about it right now, so don't be worried yet. Okay. All right. Perfect. Well, if you don't have any more questions, I'm going to let you get dressed and I'll see you up front.
Okay, thank you.